Welcome to the tale of two Dr. Laras. This is the Right Brain Recess, and I'm your host, Dr. Lara Salyer. This is where we take your creative brain out to play, and you learn tips and tricks to elevate your happiness and well-being by tapping into your own creative flow state so you can avoid stress and burnout. Today, it's the compare and contrast of two Dr. Laras, 2016 and 2021. And we're going to do this with a patient's story. But first, I have to make a comment about family practitioners everywhere. I absolutely loved my journey as a family medicine physician in the rural area, both in Missouri and Wisconsin where I practiced. I loved that I had the ability to get to know families on many levels, multi-generational, from babies to grandmas and everybody in between. We understood the interconnectedness. We helped on a social and physical level. We were able to intervene with less costly measures before a patient might need to go to the ER or for a bigger surgery. For example, I loved doing women's health, endometrial biopsies, IUD placements, colposcopies. I also loved fractures and lacerations, and yes, even office surgeries like sebaceous cysts. I mean, there's a reason there's a Dr. Pimple Popper. It is kind of satisfying. So these are the things that family medicine is really good at. And we need to know that these doctors are on the front line and they're doing the best that they can in a system that is unfortunately toxic and decaying. There's only so much you can do in 15 to 20 minutes, but boy, do we try hard. And I found a natural evolution where I hit a ceiling. I felt like my skills were there, but I could use my services in a more expansive way elsewhere, which is why I resigned in 2017 and opened up my own practice in functional medicine. So now you're going to see the difference of who I was and who I am now. And it's not a either or, but more of a yes and. You'll understand better how family medicine can serve you and where some of the deficiencies are, and how functional medicine can help you excavate and uncover things that might be missed. So, another disclaimer, all identifying features in here have been changed. This is not an actual patient, but does take elements from patient visits that are in fact true. So let's get started. I'm going to read to you what this patient comes in with and how 2016 Dr. Lara would handle it versus now. So this patient is a 59-year-old female coming in for fatigue, anxiety, brain fog, and stress. She feels like she's slowly gaining weight and bloating after menopause. She has joint aches and pains in the usual areas, her hips, her back. Her sleep is fragmented, and her anxiety is worsening, especially after her husband has been diagnosed with a terminal cancer illness, and he's rapidly decompensating. So for stress relief, she enjoys cooking in the kitchen while sipping wine, and she likes to read. So Dr. Lara from 2016 would welcome her into her office and start talking about her own symptoms that she's noticed and order the expected labs. Thyroid testing, anemia, liver, kidney. Also, Dr. Lara would be scanning to make sure that that patient has had all her screening tests like colonoscopy and mammogram and tetanus shot, because again, this is part of what we're responsible for, is public health. And I would start by suggesting support in the form of a referral to behavioral therapy, talking about other support groups in the community, and even a referral for osteopathic manipulation or physical therapy because I didn't have time to do it in my exam. And then finally, I'd steer that conversation to what can I do to help? What concrete thing can I give you today that might help your pain, both mental and physical and all of the above? And usually it's a conversation about prescription options. So it would be one of three things I think commonly would be like Zoloft and SSRI, Prozac, things like that, or maybe even hormonal replacement therapy if we find that she's experiencing more hormonal symptoms like hot flashes, or maybe even a sleep aid. If it sounds like she doesn't have sleep apnea, but she's just waking frequently, maybe a temporary sleep aid might help. I would mention alcohol, but I wouldn't have time to discuss its implications, but I would suggest that maybe abstaining from alcohol might help. And then I would offer her to pick something and come back in 1 month. So in 1 month, she would come back and we would usually just talk, check in and see how that prescription suited her. And if it felt like a good fit, I would emphasize some of the other suggestions that we had mentioned last time and set her up with a more sustainable long-term prescription and give her the send-off of let me know if you need anything. If that prescription wasn't working, we might pick from another couple options. So that's 2016 Lara. Now, 2021 Dr. Lara is a little different. If that same patient came in with stress, anxiety, bloating, weight gain, first I would spend time combing through their medical history. And then when they did sit in front of me in my office, we have 60 minutes together where I'm telling them all the things that impact their physiologic timeline. We go through their birth history. We go through their injuries, whether it's physical, emotional, mental, and how all of those things impact their physiology at a cellular level. It can either create more inflammation or dampen it. And we talk about how the environment plays into this, whether it's toxins or mold or exposures to fumes or other byproducts. We briefly talk about nutrition, how food can be friend or foe, and maybe certain choices might not work anymore for this age and time. And then we investigate coping skills. Does this patient have a growth mindset or more fixed? And is there ways that I can help her see some of the more empowering things she can do to help her feel better? Usually that first visit, we'll talk about gut healing. We'll start with a 5R protocol and begin with an elimination diet because that will neutralize a lot of that inflammation that's going right now. We'll start with targeted therapy and her supplements, and then I definitely would educate her heavily on alcohol. I would ask her to abstain for a few weeks. The thing is, I don't wait a month to see my patients. Now they can see me every week in my group open office hour visits. So there's a lot of good support to make great changes. And they have access to a health coach. So I don't wait a month to follow up. But guess what? When that patient comes back in a month, they've already lost some weight. Their sleep is better. They've connected that alcohol might play a big part of that. And their joint pains are even gone. So she's feeling surprised and almost a little hesitant of how magical this can be. But that's okay because we still have time together. The process in my office now is a graduation process where it's like school, like going back into class, just all about you. So we aren't even started yet. Now we pick the next best test for her. It might be a urine organic acid test where we investigate her mitochondria or her vitamin deficiencies. It might be a stool test where we look at her microbiome, or it might be a hormone test. But at that point, we're going to pick our next best test. And while that's cooking and we're waiting for results, I'm going to coach her on getting caregiver support sooner rather than later. I'm going to talk with her about how she plans her day because her brain fog is due to a lot of burdens of decision making and caring for her spouse. So how can we help her brain be optimized to its full potential? We can do that by planning flow triggers in her day and avoiding flow blockers that can kick her out of flow. And also we can save those low value tasks for times when she is more cognitively drained, like in the afternoon. And that keeps her fresh in the morning when she has high cognition to do the things and be more productive. We also work with her sleep cycle and augment her sleep with some supplemental help. And this is wonderful because, see, now she can come back even better in a month. And eventually, when she's feeling like she has her symptoms under control and understands with clarity exactly how she got off track and how she can get herself back on track, then my job is done. And I send her off with a graduation action plan so she knows where to go if she's in the red zone, the yellow, or the green. And if she ever gets off track, I'm here. And that's how we can impact the health of the world, by teaching sustainable lifestyle, wonderful lifestyle things and habits and behaviors that can change the way we view our body and mind. So if you're ready to color outside the lines and you want to find a functional practitioner near you, check out www.ifm.org. If you're a Wisconsin or Illinois person, hey, come and see me. I'd love to connect. You can head to my website, drlarasalyer.com, and I can help you color outside the lines and optimize your own creative flow state. Have a great day.